Okay, so this is Dr. Lenz again. Welcome to Module 4 in Foundations of Healthy Lifestyle Management. Okay, so we're going to talk about the U.S. healthcare system today and some social justice issues related to it. But I want to start with a story first. In a couple of months ago, my grandmother, Grandma Alice, passed away. God bless her. She was the bomb. Was a wonderful lady. Lived a fantastic life. And when a couple of weeks ago, we were at her home and going through some things, and as normally you would, she was able to live in her home her entire life. And one of the things that we came across was the medical bill that she received from one of the births of her children. Okay, she had 4 kids, and her second oldest, born. I took a picture of it. I had to snap this. This was great, so I could share it with you. Okay, so he was born in Carroll, Iowa, at St. Anthony's Hospital on December 29th, 1948. Okay, so this is just to give you some context. This is a 1-page sheet of paper. It's typed out, itemized by line, but very simple. Of course, use a typewriter. So I'm just going to read to you what the costs were in 1948 in December. She stayed in the hospital for 7 days. Okay, so the delivery of the child, my uncle, cost $15. Labs and hematology cost $1.50. The room stay for the 7-day time period was $36. Care of the baby was $12. Radiology was a quarter, 25 cents. Urinalysis, 50 cents. Drugs and dressings, $5.50 for a grand total of $70.75 paid for by my grandfather on the day that they left the hospital to go home. So, fast forward. I've got Nancy and I, my wife Nancy and I have 4 children. The first one, our oldest, was born in 1996. The fourth one born in 2007. And I believe, and I don't have the date, I need to find the actual bill for our 4th child, but easily over $10,000. So how did we get from there to here? That's and the complexity. I can tell you, I'm sure many of you have children. Pages and pages and multiple complexities for what these bills look like when they come for any type of medical care. So it's interesting to note from back, what healthcare used to be like and what it is. We receive great care from our hospital and physicians and whatnot, as I'm assuming my uncle did and grandmother did as well. So today we're talking about the U.S. healthcare system, and here's a great reference for you. I've got it attached to the Blue Line site, so you can download this or read it if you would like. It's not a requirement for the course, but certainly it would be worth you reading at least the executive summary, because we don't have time to go through all the complexities of the U.S. healthcare system. This document lays it out for you, and the executive summary, which will only take you a few minutes to read, will give you a very good overview, broad picture of what the U.S. healthcare system looks like. So, okay, here's a date for you. 1930s. This was the decade when private health insurance began in the United States. Okay, so my uncle, born in the late 40s, they clearly did not use insurance for that at the time, but this is when private health insurance started in the U.S. So not that long ago, in the broad picture of our health and health care as we think about it. Not until the 1960s, though, were federally funded government insurance programs, Medicare, Medicaid, actually came along. Important for us to realize this, because private insurance was in the works for 30 years before federal insurance, health insurance programs even started. Medicare, as many of you know, Medicare, federally insured funded program for folks who are beyond the working years, where their insurance came from their employer, so the government pays for that. Medicaid is the insurance programs for low income. So just to give you some perspective, this is what we're talking about. Who laid the foundation? Who had a head start on this? It gives us some context of why insurance is the way it is today. As you read the document that's attached, at least the executive summary, and you didn't have to read the document to get an appreciation for this, but the complexity of our system is so significant, and largely because there are so many involved with it, and the document calls them actors, so I'll use that same term here, but there are many actors in the system, which makes the system very complex, and consequently leads to very poor organization of the healthcare system, which is one of the reasons we have so many problems with our healthcare system. Just to give you an idea of percentage-wise of the U.S. population covered by public or private insurance, only 30% of the U.S. population is covered by public funding, but 54% by private funding. Again, more pieces to the puzzle of who's driving the ship. If a majority of the folks are covered by private insurance, then private insurance is probably driving the ship. And does that is that a good thing or is it a bad thing? It just is. But it gives us part of the, I don't think it's neither good nor bad, but it just gives us part of the picture to the puzzle of understanding why the system is the way it is, largely driven by private insurance. One of the major issues we have in this country that we're trying to address currently are the number of Americans who are uninsured. And to be fair, probably the most significant issue for us is just that. A high percentage of our population is uninsured. This is in 2013 data. Without getting into any type of political conversation here, it is one of the major reasons why the Affordable Care Act, ACA, was pushed forward, is because the number of uninsured Americans is contributing to many of our health issues, health disparity issues in the U.S., largely driving a lot of our healthcare costs. At least it's part of what's driving the healthcare costs anyway, and perhaps a lot of the performance issues that we have. Another stat for you: the percentage of Americans who are providing some form of informal health care is 23%. Nearly 1/4 of the people who live in this country are providing informal health care to someone else in some form or another, so largely to family and friends. It gives another glimpse into why the healthcare system is the way it is. Is this because people can't afford it? Is it because they don't have access to the healthcare that they need? Is it because the healthcare system doesn't know the individual to the level that they need, and so family and friends can provide better care? Are they providing the right type of care? So again, just another piece of the puzzle for you to help you understand what healthcare system is like here in the U.S. This is very difficult to see on the slide here, and that's why you have the slide deck for this. But what this shows you, this slide deck, are the wealthiest nations in the world, and what the healthcare system looks like, for, at least in performance and cost, look like for them. So what I want you to see on this is where the United States falls in line here. What you will notice is that out of the 11 countries that are listed, the 11 wealthiest nations in the world, the performance of the United States is number 11, meaning that's the lowest out of all 11. But looking at the bottom line for the amount of money that is spent, the United States is far and away spending more money than anyone else. The next closest country is Norway, and actually we're spending about 54% more money on our healthcare system than the next closest country, but easily getting outranked by everyone. So why is that? I mean, what is it about our healthcare system in the United States? I mean, most people would argue, if they don't know, if they've never seen this before, that our healthcare system is the greatest thing in the world, and in many ways it is. We are far and away providing better care in certain conditions than compared to anyone else in the world. Examples of this could be some types of cancers, but there are other chronic conditions that we're performing very dismal on, chronic respiratory, like asthma, or nutrition and obesity. But the bottom line is we're spending a lot more money overall with a lot poorer outcomes overall than what other countries who are look like us are doing. So what does this mean? We've got a very complex system. This means the solutions can't be simple and are not simple, and this is why we struggle with them in the U.S. One of the things that I think is an area that we could make some ground in this is at the worksite health, worksite wellness programs, and that's actually why this program, the Healthy Lifestyle Management Program, is one of the areas of focus is on worksite wellness, or employee health, or employee wellness, however you want to say it. Because this is a great area that we can make some ground in this for lots of reasons that we will talk about as we continue to move forward in other courses in the program. All right, so how does this relate to social justice, and what is social justice? Start there. There are so many social justice issues related to healthcare and health and wellness in general. And when we look at the healthcare system as we know it in the United States, and we're just talking about the United States, we're not talking about poorer countries, just looking at the United States. So let's just backpedal a second and see, let's just lay out what social justice is, and essentially, very simple definition here, but confronting structures in our world that perpetuate poverty and injustice. A very broad definition for what social justice is. Very much of what we need to be doing here at Creighton University, in fact, is a significant part of our mission, social justice in many settings. So what do we do about it, about social injustices? We provide service, we provide justice for the situation, dialogue about it, advocacy to make some headway in getting past these social justice issues. There are lots in healthcare, and I just listed a couple of ones here. So how about uninsured and underinsured Americans being one social justice issue? Did you know, here's a trivia question for you, did you know that 60% of the personal bankruptcies in the United States are due to medical costs? Is that right? Should our healthcare expenses be such that it drives people into personal bankruptcy? So they're already dealing with a difficult situation for health and health care, and what that does, not to mention financially, but putting 60% or 60% of the bankruptcies being related to medical costs. I would argue that's a social justice issue. Access to medical care. We just talked about this in a minute ago of the reasons for the Affordable Care Act. Is it right that people who have enough money can get better access to care, or maybe even better care than people who don't have enough money? Is that right? Should we be set up in our system to provide just for the rich because they can afford the care? Again, we're not getting into a political discussion about that and about socialized medicine. I mean, we could easily go down that road about the pros and cons and what that means. But just talking about it, speaking to a social justice issue, I'd argue that's clearly a social justice issue. Let's bring it to more of something that's more wellness related. What about access to fresh food and high quality food? We know that there are food deserts, as they're called, in certain pockets of communities, especially urban communities, where there's no access to fresh fruits and vegetables or whole grains, fresh food in general, high quality foods in general. Some people only have access to food that comes in a foil package. Is that right? Is there something we can do about that? Is because they live in that part of a particular city and don't have access to it that it just is what it is for them, or is there something we can do about it? I think that's a social justice issue. Another one that it doesn't matter where you live or what your demographics are. Do you know how to navigate the grocery store when you go? When you go to the grocery store, do you know how it's laid out? Do you have a plan when you go in there? Do you have enough education to know how to navigate that successfully, to buy the right types of foods at the lowest cost possible? Clearly, the food industry has set up food stores purposefully because they know how people navigate, and the idea of a food store is, of course, get people to buy what's in there. Is that a social justice issue? I think that's a good conversation there. One more so maybe related to wellness, but absolutely critical to overall health. So how many social justice issues can you think of in our healthcare system, in our health and wellness system as we know it? Just try to brainstorm. There are lots of them out there, and I would encourage you to brainstorm what those might be. So our discussion this week is on that. Think of a social justice issue related to our healthcare system, to something in health and wellness, and let's talk about it. It doesn't necessarily, not the ones that we listed here, could be the ones we listed here, but think of more, and let's have a discussion about those. So that's it. That's a very broad overview. I hope you can read a little bit more about it to get more information. There's certainly a lot of information that you can gather on this topic. So let me know if you have any questions. And I can't wait to read what the discussion sounds like for this. So until we meet again, have a good day. Thanks.